Hi, my name's Chuck Cole, and I wrote the book, A Fix to the Looming Healthcare Collapse. A little bit about myself. I've been in the insurance business since the 1980s, and I've seen the many problems that have never been fixed since I first started in the industry. And in the book, I talk about a lot of those problems, but I don't want to go into boring you about that right now. What I want to do is just give you a quick overview of what's in the book and about the problems and the solutions. A little bit about um, myself. Not only have I been in the insurance industry for all those years, but my wife is a nurse practitioner. So I've heard from her side, from the medical side, all the problems that they've faced. I've heard from my side all the insurance problems that insurance companies have faced. And I've heard from actually my thousands of customers on the problems that they've faced over the years as far as dealing with insurance companies and dealing with doctors and hospitals. So, after hearing all those problems, I needed to put together a book to explain all these problems, but more importantly, to come up with a solution that will help and actually will take care of all these problems. And actually, it'll also take care of the Social Security problem, which is the second biggest problem we face. My solution is one that both Democrats and Republicans alike can get together and vote on. The Republicans, they want everything private and they want less government. Actually, my plan is all private and it does get rid of a lot of government intervention and a lot of government agencies. What do the Democrats want? They want health insurance coverage for all, good quality coverage that'll increase the health and make Americans overall healthier and healthcare that everyone can afford. My plan does that. So, what's the biggest problem right now? Right here behind me, 60,585 by the year 2030. The cost per person for healthcare in America. I will show you in a second how I arrived at that, but that should scare everybody. By the year 2030, everyone's going to have to pay $60,000 a year for healthcare. And these are figures that when you see the evidence, it cannot be denied. That's where we're heading. And how's the average American going to be able to afford it? They're not. So we're going to have to do something about that. Bear with me here. And I wanted to show you this. This is a cost. Can't see it very well here, so I'll put it back where it was. The cost per person for healthcare, or I'm sorry, the cost for medical care per country in the year 2020. The United States was first at 11,945. I don't know if you could see that, but that's what it is. Switzerland was second at 7,100. The average industrialized country was $5,754, less than half of what we pay for medical insurance. Japan was the cheapest at $44,691. So basically, in 2020, it cost every American $12,000 a year for coverage. Here's the problem: health insurance has gone up by 17.63% every year. And if you look, once again, I don't know if you can see this, but the average healthcare cost every year is up 17% every year since 2008. So that's a problem. So if you take 17.63, I'll put this back up here in case you want to take a look at it. If you take 17.63% and you take that number and well, first off, you have to take $12,000 and you compound it by 17.63%. By the year 2030, you're going to come up with $60,000 per person. And the numbers aren't going away. As you can see, the compounding interest or percentage rates keep on increasing, and they're increasing at an increasing rate. Give you an example: the drug Ozempic, which everyone sees on TV and About 20% of America, I think, anymore is on Ozempic, especially in older adults. That drug costs $1,300 a month. So how can we continue on at $1,300 a month just for one drug? That doesn't include the cost of going to the doctor to get the prescription or all the other health problems you have or all the other drugs that you may be on. But you can see it's unsustainable and we have to do something about it. So I want to take a second here. Um, there's several problems that have led to this increasing rate. And some of them are problems that you've never even heard of. One of the major problems is um, people who have no coverage. I'm not talking about people on Medicare or Medicaid. I'm talking about people who just go to the hospital and don't pay their bills, or go to the doctor and don't pay their bills. People would be shocked to learn how much that cost us. In the year 2015, it cost us $56 billion a year just in hospital write offs. Okay, that was basically almost 9 years ago. So when you compound the 17.63%, and then you add in all the illegal aliens that are coming in, and a lot of them have health problems, and a lot of them are being treated for free, my estimate is we're somewhere between a quarter of a trillion and a half a trillion dollars we're paying just for people who have no insurance. And the people who have insurance are footing that bill along with taxpayers. That's just one problem. The other problem we have is the bureaucracy in the United States. There are over 10 different ways that doctors and hospitals are getting paid right now. They're getting paid by such things as Medicare, Medicaid, but they're also getting paid by auto insurance, workers' comp, individual health insurance, group health insurance, liability insurance, the VA, private pay, no pay. As you can see, the list goes on and on. And all those different methods of payment all have their own set of rules and regulations that doctors and hospitals have to follow in order to get paid. I did the math and I figured out that basically a hospital system has to follow 36 million pages of forms and regulations that they have to follow a year in order to get paid. Now, granted, most of those are automated, but what's it cost to automate 36 million pages of forms and regulations? If you talk to any doctor, they'll just tell you that it's just gotten out of control and it's ridiculous. So then we have the problems like I talked about, the illegal aliens coming in, and the cost associated with that is no one's even been able to put a price tag on that yet, but it's going to hit us hard. So we have all these problems. We're going to be paying $60,000 a year in 6 years. How are we going to fix it? Well, basically, I've come up with a solution once again that we can all agree on that will help that everyone will be able to afford and everyone will have coverage. Basically, what we need to do is we need to use one form of insurance, and we're going to use the Medicare Advantage program. And we're going to use that, it's not going to be part of Medicare, it's going to be its own hybrid, but we're going to use that structure as the Medicare Advantage program. And why are we going to do that? Medicare Advantage programs have a 98% satisfaction rate. And the reason why they have a 98% satisfaction rate is due to the fact that they have what's called a star rating program. The star rating program, basically what they do is they have 70 different criteria that they track, and they give a rating between 1 and 5 stars to each insurance plan out there on the market. The higher the star rating, for the plan, the higher the insurance company gets reimbursed by the Centers for Medicare and Medicaid. Why is that important? They track things like how fast they pay claims, how accurate do they pay claims, are they making their customers healthier, how many customer complaints do they have, what's their retention level, what's their prescription drug plan, what types of services are available to their members. So all these things are tracked, and basically it shows that insurance companies are getting paid to do the right thing, as opposed to right now, some insurance companies out there have found that it's better to do the wrong thing and deny claims and delay claims and make things harder for people, and they can make more money that way. But under the Medicare Advantage programs, they found out that they make more money by doing the right thing and helping people out. So we would use that as a basis for our program. Just to have one system of that. And also, this is America. You could also pay cash. Those would be the only two ways that Medicare would be, or medical services would be delivered in the United States. So the big question is, okay, that sounds great. How are we going to pay for it? How are we going to pay for everybody? We're already so far in debt. Yeah, I've seen so many different estimates on how many trillions of dollars we're going to be in debt in the future. Yeah, who knows? So how are we going to add on all this cost? Well, we're not. My program is actually going to reduce the debt and reduce cost. Basically, what we'll do is we'll pay for healthcare with the national sales tax. I have done the calculations, and basically, to insure all Americans, it would cost between 5 to 7% sales tax. That's not that much. And that's not taxing food or medication. That's just taxing everyday items like clothes I'm wearing, the desk that I'm sitting behind, things of that nature. Um, the money that would be saved, people who work, their employer would no longer have to pay for the health care. They could give all that money back to the employees, and the employees would have that money to pay for the sales tax. But it's important that everyone pays into the system. Now, one of the biggest criticisms that people have come up right away is, well, you're taxing poor people. Well, my plan actually goes into a way of preventing that. My idea is that anyone who receives a government check, other than government employees who are earning a full salary, but people on Social Security, people who are on disability, people in that nature, they would receive their normal cost of living increase. And then on top of that normal cost of living increase, give them an additional 3% increase, which would pay for the sales tax. Because remember, not everything's going to be taxed, and they're not going to spend every penny they have. So when you get that, um, it's going to be a net zero effect to poor people. Now, the people who are going to get hurt by this sales tax cheats, people who don't pay their taxes, illegal aliens, you see them shopping at Walmart. They may be getting paid under the table, but yet they still go to American stores and buy things. So now they're going to be contributing to their health care, where in the past they weren't. Um, Also, billionaires. Yeah, the billionaires who have so many tax write offs, they're hardly paying for anything. Well, now when they buy their $100 million yacht, they're going to have to pay $5 to $7 million in taxes on that. So now they're going to have to start paying their fair share. And this also gets everyone to buy in the fact that they need to contribute to healthcare, their own healthcare, to lower it all. Any other criticism I have about the sales, I've heard from people about the sales tax, is that you've got a situation where government's going to have this money and they're going to spend it on something else. What I put in my plan is that the government can only collect up to 1 year in advance the premiums. The sales tax would be adjustable every quarter so that they can't store this money and they can't spend it on anything else. It has to be spent on health care, and the insurance companies have to spend 80% of all the money that they get strictly on claims. They only get to 20% on the administration, marketing, and profits to work with, which leaves them enough money to make a profit, but they won't be making any excess profit on anything. Just like it is today with the Medicare Advantage programs. And you'll see some plans have actually gotten better every year because the companies did not reach their threshold that they had to pay every year. And so they had to give increasing benefits the next year to try to get rid of that excess money that they earned from the previous year. So that's how we're going to set it up. Now, I also talked about how this is going to fix Social Security. And people go, what are you talking about? Fixing Social Security? This is healthcare. Well, Social Security is the second biggest problem that we're going to be facing besides healthcare. In the next 7 to 10 years, it's estimated that Social Security is going to be about 17% in the hole. No politician wants to raise taxes, and no politician wants to cut benefits. Nikki Haley, when she was running for president, got crucified because she wanted to, for 20 and 30-year-olds, to cut the benefits on them 40 years down the road. And people went haywire over that. So politicians just stay away from it. In fact, in the United States Congress, there's not even even though this is one of the most important topics in America, there is no subcommittee in the House of Representatives on healthcare. They've got subcommittees for everything else, but they just don't want to deal with healthcare. And that's something that should be fixed. But back to Social Security. So my plan, the way to fix Social Security is right now there's a Medicare tax that people who are working are paying to help fund Social Security. Or I should say Medicare. It's 1.45%, and your employer matches that at 1.45%. So it's a total of 2.9%. So Medicare is going to be gone under my program because remember, we just have this one system, and it's a total hybrid system that we're putting together. So this tax is already in place. So take that tax and just reallocate it to Social Security. You're not raising anybody's taxes, you're keeping everything the same. But now by putting 2.9% more money into Social Security, now everything is fixed and everything is under control. Um, I also want to talk about all the advantages that this program is going to bring. And once again, I should have done a little bit better job with these notes, but this talks about Social Security, the 17% less than 10 years. But here, let's see if we can see some of these. Here's a recap of the benefits. Um, Something Democrats and Republicans can agree on. That's the most important thing because even like when Obamacare started or the Affordable Health Care Act, um, there was total fighting between the two parties. But this has something that both parties could come to the middle and agree on. It ensures all Americans. That's important because right now, the United States is not in the top 10 in any measurable health category. Yeah, we have probably the best hospitals, the best doctors, and best research, but yet we don't deliver it to the people. For example, we're not in the top 10 in infant mortality. We're not in the top 10 in longevity. We're not in the top 10 in most categories that you can measure healthcare by. And that's because of our delivery system, not because of our hospitals, not because of our doctors. It's because of our delivery system and how it needs to be changed. Gives freedom of choice. This is important too, that people didn't think about. How many people are working right now and they have health care through their company, but it's a horrible plan. Maybe it's a $5,000 or $7,000 deductible plan. Maybe it doesn't cover the hospitals that are close to you or the doctors that are close to you. Maybe the company doesn't pay their claims on a timely basis or doesn't pay claims at all. This plan gives you the freedom of choice to go through and go to different. If one carrier is not doing the job, every year you'll have the ability to switch and go to a different carrier, into a different plan and one that fits your needs. And that's very important. In fact, in the book, I talk about how no insurance company can have more than 20% of the marketplace in any one state. So at least 5 companies have to be out there competing, and no one company can dominate to create a monopoly that will hurt individuals. Helps develop new business. This is in a couple different ways. This would help to develop new business, but the main way is one of the main problems we have in America with people starting new businesses. Well, the number one reason is lack of capital. Yeah, if you don't have the money to start a new business, um, you can actually go out and find investors. If your idea is good enough, you can go out and find people who want to invest in that company. But the second reason why people don't start their own business is a lot of times something that people can't take care of, and that's healthcare. Maybe people have health issues, health problems. Obamacare is just, or the Affordable Care Act is just too expensive, and they just can't go out and start their own company. This allows people the freedom to not worry about health care. You know, they may have enough money saved to get by for a while, um, as long as they don't have to worry about what happens if I have a major healthcare event. It also helps American companies compete in a global marketplace. In America, we are the only country that makes their corporations pay for healthcare. Most other countries, um, they that's not the case. It's either government provided or individually paid, or most countries. I shouldn't say most. A lot of countries are a combination of both. Um, in America, if we do away with this, country or companies would not have to pay for healthcare anymore. And why that is important is, yeah, they're like I talked about earlier in this video, they're going to have to. Well, they don't have to, but they should give back the premiums to the individuals who workers, so that they can pay for that sales tax. But where they save money and they save a lot of headaches is the cost of administering healthcare, which is pretty significant. And especially, I've talked to business owners from the 25 to 500 category. Um, they spend a lot of time and a lot of effort and a lot of money just getting together the healthcare. And I actually talked to a congressman who owned a company of about 200 employees, and he talked about how healthcare almost put him out of business because one year they got an 85% increase in their healthcare, and the cost was almost too much for their company to handle. Those are the kind, and there was no one else they could go to because they had a lot of sick people. Well, I shouldn't say a lot. They had a couple people with cancer with extremely high claims, and because they were experience rated, it almost put their company out of business. That is going to end with this. Companies aren't going to have to worry about, oh, wait a minute, Joe's a great employee, but his wife keeps on having those cancer treatments that cost hundreds of thousands of dollars, or she has to go to dialysis or whatever. And we just can't have Joe around anymore because of those problems. So we're going to have to fire him just because his wife or his son or his daughter has these medical issues that is just costing us too much money. Um, it's going to lower other forms of insurance. Well, how's this going to help other forms of insurance? You're going to see your auto insurance premiums go down because auto insurance is no longer going to pay for healthcare. You're going to, businesses are going to see their workers' compensation insurance go down because, once again, if somebody gets hurt on the job, they're not going to be paying for someone's health to be treated at a hospital. Their medical insurance is going to pay for that. Now, they'll still be on the hook for time off of work and also for pain and suffering. But as far as paying for the actual medical expenses, they're not going to have to do that. Your homeowner's insurance is going to go down. Once again, if somebody gets hurt on your property, their individual medical insurance is going to pay for that. So a lot of forms of insurance, your bills are going to be decreased, which can help pay for that sales tax. It helps narrow the income gap for all Americans. One thing I've noticed, I told you earlier in this talk that I'm a financial planner as well. And seen over the years, when I grew up, everyone seemed to be in the middle class. Now, you could be in the upper middle class or the lower middle. Of course, there was your rich people, but they were kind of far and few in between. And there were your poor people, but they weren't as big as they are today. Are people who are struggling to make ends meet. That middle class has kind of disappeared. Now, it hasn't disappeared this way, it's disappeared this way. I have seen the wealthy or the upper middle class expand greatly. There's a lot of people who have money that never had money before. But I have also seen this side come to the middle too, where people who have normal jobs, maybe they're a mechanic, maybe they're a heating and air conditioning guy, whatever, they're struggling, and it's almost impossible anymore for them to be able to pay the rent or pay the house payment, pay for health insurance, and pay for food and everything else, pay for the cars. All those expenses have gone up greatly, and they're struggling. A lot of Americans are struggling. So how are we going to help this poor side that is greatly increased? Well, if they don't have to worry about health insurance anymore, it's going to move this back over here some. So we're going to expand a little bit of the middle class. This is the middle class here. And that's what this program will do. And it's a big benefit. Um, I talked about this a little bit before, but people who are cheating on their taxes, you know what? Guess what? They can't get by with the sales tax. And there's a lot of people cheating on their taxes. In fact, the problem with just having this off the general revenue of the United States is less than half the people who can be paying taxes are paying taxes right now. And that's got to change. We'll fix the Social Security problems. We talked about that. We'll allow people to leave their jobs they do not like, and they're just staying because of health care. There's a lot of people who they wake up every morning and, oh God, I hate my job. But I have to stay there because I have health problems or some family member has health problems, and I cannot leave. I cannot start my own business, or I can't go to a competitor because they're not going to hire me because of these health problems, or they don't have enough health insurance, um, or they don't even provide health insurance. So people are stuck where they're at because of their health insurance that they have with their current company. This allows them the freedom to be more flexible and move to the jobs that they like. Um, will increase the overall health of Americans. That's huge. Um, we talked about all the problems before, but now there's so many Americans that have these high deductible plans. They're not going to the doctor for their normal checkups. They're not, when they have an issue, they're putting it off until it becomes a major, major problem. A lot of people who could go to their doctor when they feel something or have a minor problem, it might be cancer. And for example, if you see a little mark on your arm and oh, that'll probably go away, I'll put it off, put it off, put it off because I don't want to, I don't want to pay my $500 to see a dermatologist. Then all of a sudden, it gets to a point where they know something's wrong. They go to the doctor, and then the doctor tells them that they got stage 4 cancer. When if they'd gone earlier, everything would have been taken care of when they first noticed it. Or during normal routine checkups, these problems would have been discovered early and they could have been fixed at a small fraction of the cost, and it would have not developed into something that maybe not could have been taken care of and will eventually lead to the death of the person. So these are just some of the problems that we've talked about. Um, and with this video, the reason why I'm showing this video too is I found out that, you know, people aren't reading books like they used to. And when they do read a book, they want to be entertained. They don't want to sit there and read about all the intricacies of how our healthcare is collapsing and how to fix it. But I hope this video has sparked a new talk in America about these problems and the want to read the book. But even if you don't want to read the book, just knowing these problems and knowing that there's a fix and starting a conversation with people. I don't even care if no one buys my book. I really just want to start the conversation, get people out there to do something about this, talk to other people, because knowing that health insurance is going to be $60,000 in 6 years, um, it can't happen. Now, do I believe health insurance is going to be $60,000 in 6 years? No. What's going to happen is they're going to start cutting benefits. They're going to start cutting what's covered. Healthcare in America is going to collapse. That's why I put that in a book. I didn't say insurance is collapsing, healthcare is collapsing. And for example, maybe we start not covering Ozempic and other drugs because they're just too expensive. Any drug over $50 is not going to be covered, or maybe we don't even cover drugs anymore. We might also see where certain procedures we're not going to give to people over age 70 or 75 because we figure their life expectancy is only a couple more years or another 10 years, and it's just not economically feasible to treat those people. So you're going to see all kind of problems like that start occurring in the future, or like what's in Canada now. I'll go back to um, a part that I skipped about Medicare for all. Talk to the people in Canada. If you need a hip replacement, it's a year and a half to get a hip replacement. And you don't choose your doctor. You're put in a pool, and whatever doctor a year and a half from there, so in other words, you're in pain for a year and a half, whatever doctor picks out your number, that's a surgeon you go with. It could be someone just out of school who really doesn't know what they're doing. Maybe they have a terrible reputation, but that doesn't matter. That's the doctor that you got stuck with. You didn't have the ability to go out and go choose the best doctor in the best hospital. Primary care physicians in Canada, it's the same concept. You need to see a primary care physician, you're put in a pool. When your number's drawn, whatever doctor is assigned to that, that's a doctor you go to on that particular day. And that doctor may not know anything about you, but he or she um, will just read from the internet, read your history and diagnose you. Where in America, we develop relationships with our doctors so they know about you, they know about your physical health, and they know what to be looking for when you come in and how to keep you in top physical health. Um, if you, I hope this has been informative. Once again, the name of the book, as you can see, it's been over my shoulder the whole time. Affixed to the Looming Healthcare Collapse. Here's the book. It's available on Amazon. You can just go to Amazon.com, click on books, and just type in my name, Chuck Cole, ChuckCole. If you need to get a hold of me, just chuckcolefinancial.com. I'd be more than happy to talk to you. You can email me, and we can talk more. But more importantly, just put this word out. If people don't buy my book, that's fine. But we need to fix healthcare. Thank you. Good night.